Okay, so we are still celebrating Women's Health Week, and today we'll be talking about uterine fibroids. This is extraordinarily common. 80% of women have fibroids, but not all of them are large enough to cause symptoms or for people to even notice. So I want to talk about this today because it's common, but there's also a correlation with excess fat or weight. So the uterus is a organ that has a lot of muscle, and in this muscle layer, growths can occur. And when that happens, we call them fibroids. These fibroids can cause pain, discomfort. They can be associated with heavy menstrual cycles or even longer menstrual cycles. And depending on the location, they can even block certain areas of the uterus and make it difficult for pregnancy or cause infertility. So these are typically diagnosed by a primary care doctor or by a gynecologist based on symptoms and pelvic exams. I'm not going to get into a lot of the treatments, but some of them are birth control for people who have really heavy periods and have low iron and have a lot of symptoms from that. The most extreme treatments would be hysterectomy or removing some of those fibroids. What I'm mainly going to talk about is the relationship to weight. So what I see in my clinic for women who have fibroids, and this is most common in African descent women or black women for reasons that are unknown. It's also very common in families, but for patients that I see, when we have a reduction in fat, which the hormone estrogen is made from fat, these fibroids are not fed as much or do not have the propensity to get as large. So with weight loss, what we see happen, especially with women, is there's a better hormone regulation and a lot of things get better. We're going to be talking about PCOS in a couple weeks and that relationship to weight as well. So the purpose of these topics is to make them kind of hot topics. We're going to talk about them kind of briefly and quickly and kind of put them out there and go over them and give you a little bit of information about them. When we do the Facebook Live on PCOS, that's going to be a 20 to 30 minute segment, so you'll definitely have a lot more time to be interactive with me and ask questions, and also ask our OB-GYN doctor questions, Dr. Parson. So that's it with fibroids, and we'll talk about some other topics for the rest of the week.